We welcome in today's talk show Dr. Nitish Vora. He is a senior consultant pediatric neurologist and epileptologist, director of Royal Institute of Child Neuroscience, RICN, Ahmedabad. You are most welcome, sir, and I hope that all the members will be benefited by your talk. Please carry on.
Thank you very much, sir.
Yes, sir. Start.
Sir, so I will share my screen.
Yes, sir. Please go ahead.
I presume I'm audible and I can slides are seen properly.
Yeah.
So thanks Tuteja sir for this opportunity. And the month of autism is just awareness month of autism is just finished. So and there's lots of information available to professionals, doctors, and parents. So let's do demystifying the facts and myths and exactly where we are and some concrete answers to some of the questions. So that's Nitish Vora. Thanks, sir, for the nice introduction. So it's about autism awareness into professionals. As we know, I'll start with a case to set up the scene. It's a 3.5-year boy crash with normal birth history, development up to 24 months, and first words at 12 months, and developed vocabulary of 20 words during last treatments up to 2 years of age. Now, then came the COVID, as this is standard history, and we'll say words disappeared, he stopped responding to his name, reduced eye contact and gesture, and less interest in surroundings, and screamed very frequently, and seems to be in his own world. And these were the complaints by the parents. And I'm sure with what we can see, this clinically looks like autism. So that's a fact. So what is autism? Because there are lots of things about autism. So we can say it's a disorder, and it's a spectrum of symptoms. So it's not a disease, and its main core features are problem with social interaction, communication, repeated behavior, sensory issues. And with that, because of other interactions, children may have anxiety, behavioral disorders, sensory issues, sleep disturbances, may have seizures, learning issues, language issues, fine motor difficulties, coordination, so many other things. But the core features are social interaction, communication, and repetitive behavior. So that's what the autism is. It's a symptoms of triad and other associated features. So as soon as I put this slide, people who are reading carefully will say, what? Enteric fever? We're talking about autism. But this is a very appropriate slide. So when anyone says to the doctors, what is enteric fever? We exactly know what is the etiology. What is the pathophysiology? And from that, exact management, right? Now, how about the autism now? Do we know exact etiology? Do we know exact pathophysiology and perfect management? When we don't know exact etiopathology and physiology, how do we know the perfect management? And that's the biggest problem at the moment. So there are lots of school of thoughts, and it's very complex. People think it's mitochondrial disorder, sometimes oxidative stress, like neurotransmitter dysregulation, hormonal imbalance, immune dysregulation, environmental stress, toxins. So other things have been thought of. And depending on those thoughts, etiology thought of, there are specific management thought of as a medications or something available for that. And that's what we're trying to treat. So we know the symptoms of autism. We know what are the issues associated, but we don't exactly know the etiopathologies and the micro level what's happening. And this is still the issue. At the moment, still we do not know exactly how the autism is caused. Yes, we know about the brain connections. So we know the typical child, if these are the connections, they are long connections and less connections. Because around 2-3 years of age, there's a pruning occurs. Pruning means unnecessary networks are cut off, unnecessary neurons are cut off, and the appropriate bigger networks and pathways are formed. Child with autism, we know they have more number of neurons. There are short neurons and multiple neurons because the pruning what should have occurred. So this is a triggered thing by genetics. So when you have specific environmental factors, you get the pruning which is induced by the genetics, your internal mechanisms. But those pruning doesn't occur, and that explains sensory issues, motor planning issues, large head, uh, and so many other connecting issues. So we know what's happening at the connection level, but still we do not exactly know how actually it occurs. So let's think means how the diagnosis of autism made, because it's very essential. People think, oh, this child like Down syndrome, this is Down syndrome. Oh, this child has autism. No, that's not the way it works, and it should not be the way as well. So it's a play-based observation of the child. There's a formal assessment with a team of professionals and experts. And there are now, apart from developmental pediatricians, there are autism experts available who are trained in autism. It should be done with formal assessment, the team of professionals, which is confirmed by DSM-5 criteria. So whether it's a US DSM-5, European, whether it's ICDS, whatever. But important thing is we identify and try to find the etiology and comorbidities. Try to label the severity of autism, mild, moderate, or severe, because this is lifetime diagnosis in a way. Is this primary autism or secondary autism? And then appropriate investigations, depending on what the cause. We'll come to the next few slides on that. Also try to clarify, is this child with pure autism or this is developmental delayed child without autism? Also important to recognize strengths and weaknesses of the child. And try to evaluate the family understanding, their dynamics and expectations, which is very essential. So I said, we need to understand what is primary and secondary autism. We know these things. And it helps a lot in diagnosis, management for the pregnancy, etc. So we know autism is caused by multifactorial things. There are lots of environmental factors, and the core thing is human interaction, social communication. So previously, when you have the joint families, everyone was there, parents are there with the child, extended family, dada, dadi, nana, dadi, kaka, mama, masi, means everyone is attached, and so many other siblings and cousins and nieces and nephews. But those things are not there. Apart from that, other factors like chemicals, food, screen, less human interaction, a macro environment with the pollutants, and so many other things. So these are the factors. Then this is second hit by genetics on these primary factors, and that's cause autism. And if we now try to still subdivide what's primary and secondary, so I'll talk about secondary autism first. It's a core genetic abnormality. So like if you say ring chromosome 20 or say, it's not rather reliable, say means any other syndromes, genetic malformations, specific genetic diseases, which have means bad autism, associated epilepsy and comorbidities. And there are plenty of genes they're thought of, but the confirmation of only few genes have occurred. So still genetics is not the answer so far, but 20% cases, yes, these are secondary cases, and they should be thoroughly investigated and thoroughly worked up, because we know these are the bad autism, it has bad outcomes as well. Primary, which is a major autism, 80% of children, they have main issue is core environmental issues. So like human interaction, social communication, food, screen, blah, blah, blah. And it's multifactorial. There are no unnecessary tests for these children. Let's do MRI, let's do genetics, let's do EEG, let's do this, that. Not required. These are multifactorial. N number of tests you do. Copper, it's lead poisoning, this factor, nothing required. Whatever tests you do, they come negative. Majority of these are good autism. Some of them can be high functioning with a good IQ, good vocabulary, and they improve with the interventions. So we need to differentiate at least good versus bad autism, or the primary and secondary autisms. That's very essential. Also, once you know the primary and secondary autism, it helps to decide and counsel the family what are the chances of pregnancy, means next child having the autism. So overall risk at the moment we can say is general population around 2%, that is 1 in 50. If the first male child with the primary autism, the subsequent chances are 5%, that is 1 in 20. The first female child with the primary autism, the success chance is 10%, because male to female ratio is very high, and girls like to have more secondary autism. First child with secondary autism, confirm, there's very, very high chance of autism next pregnancy because they are genetic conditions, autism recessive or dominant. Depending on that, it's 20 to 50%. So it's a huge number. We know some risk factors. So late paternal age, so late father's age at the time of conception, IVF, antenatal stress, all these things are the stress or risk. Which are the rewards or the supporting thing to prevent autism? Breastfeeding, kangaroo mother care, good human bonding, good touch, social interaction, all those things. So a close family, good interaction, that helps. These are rewards. So I think we can definitely counsel on that as well. So we have gone through very basics about autism, how it is caused, and let's talk about some facts and myths because we have limited time, but we want to cover very important key factors. And I hope with this complexity, we may try to get the clear answer to you, but in next few slides. So Krish, our child who has autism, mother has few questions, and these are standard questions which comes to all of us. So is this is contagious? If someone eats with my child, sleep with a child, eats with the same food, what is spread? Answer is first and foremost, it's not a disease. This is a condition. That's a neurodevelopmental disorder, which is a combination of different signs and symptoms. And of course, it is not contagious. Of course, is it one of the only few children with autism? Is it rare? Answer is no. We all know it's on the rise. Autism is very common, and with the environmental factors, human social interaction getting less and less, screen time, food, etc., it's on the rise. In India, we initially thought it's 1 in 150, then 1 in 100. But in last 5 years, now we have reached the number 1 in 50. So every 50 children, one is autism, and that's a fact. And it's across the era, means whether it's a rich, poor, village, urban, doesn't matter. It's on the rise. And the CDC, it says 1 in 36 incidents. It's a huge number. She has few questions, which are very practical questions. So does this mean my child is mad? Because people do say when they Google on Google about autism, ye man buddhi duffer pagal bacha hai, and that's what society perceives. Is it true? Answer is no. He's not mad. Yes, he has special way of learning and communication, as well as he has many strengths, and the way he communicates looks different, and that's why people may feel it's looking different. But he's not mad. Should he go to normal school? And this is a question, depends on when they are living, what support they have, what kind of schools and school support. But what we say is most children with mild or mild to moderate autism, they should go to mainstream school with some extra help or inclusion. They may need someone to one help for a few hours and rest in a main core group or small group activities. But of course, moderate or moderate to severe will need special school, which is a big resource issue at the moment in India. And of course, she asks, is autism curable? And that's a genuine question we need to answer, because some people say, oh, don't worry, ho jayega. There are therapy centers. We say, अरे मुझे इतना लाख दे दो, उसको क्योर कर दूंगा. So, would he grow out of the autism? Could he live normal life? So these are all the questions. And what we say is autism is manageable. It is not curable. So it's not curable. With a good family support, therapy, interventions, educational, social, all the support, most children in mild or mild to moderate group can manage their life. And our aim is so that they live self-sufficient, independent life with some difficulties. And they always remain on the spectrum. So, but those things keep changing. So first few years, you have problem with the communication, screaming, then echolalia, then comes the behavior issues, and then socialization issues, also peer relationship issues, and then OCDs, and those things keep creeping in, and the initial symptoms, they get lesser and lesser. But yes, child remains on the spectrum. So it's not all bad. Means we know these legends, and without any bias. Even Elon Musk, he has been diagnosed with autism. So these are good legends who are on the autism spectrum. So we should not just worry, because they have special way of thinking, they have special abilities as well. So then mama asks, it's okay, my child is going to be genius, isn't it? And the answer is these autism children have lots of special skills, strengths, but it's individualized. So children who have good cognition, early diagnosis, early intervention, and good support, they do good. And most of children raised, they have some learning difficulties, and especially secondary autism. Definitely, there are issues with the IQ, learning, and lots of issues with the behavior as well. I hope things are clear so far, and I think we are almost half done. So now some rapid things. The things always comes, and we get sometimes very surprised. Any child with autism, okay, they will have few tests done, BARA, EEG, blah, 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 late. I think it's not required. It's not required. You need to differentiate primary and secondary autism. Secondary autism, yes, you may need lots of investigations, but primary, hardly you need any investigation. So should my child with autism undergo EEG test? Answer is EEG is not as default. Only if the child has seizures. And if there are doubts, contact the neurology specialist, but EEG should not be done as a routine. Is it likely that my child will develop autism, epilepsy? Answer is there are higher chances. We agree with that. But we need to understand the complex issues, and experts can help on that. So should my child be started on anti-seizure medications? Again, answer is no, it's not default. Only if the child has epilepsy. Otherwise, no unrational or just trial of medication should not be avoided. So that's clearly not as default. I think I will skip these slides because it gives answer. Now the big thing, everyone, we are in the world of AI. Let's diagnose autism with AI and manage autism with AI, and we have special things, and now we have special answers. We need to understand the core areas of diagnosis and management of autism are human interaction and social communication. We as a human still, we 100% doesn't know what exactly causes autism and how we manage. And the AI and robots, which are the feedback is given by us as a humans, if we don't know how AI will do that. And also, we need to understand you require human interaction, emotion, socialization, communication, that social communication, interaction. And how do you expect AI to do that? And it's a culprit. We know the lots of technology and gadgets and screens are the culprit. So that we are barking on the wrong tree. It's totally wrong thing. So yes, facts. It's a good business. AI, everything at the moment, I would say it's a good business. And of course, people try to sell different things, new things, fancy things as a business, because in the business you keep updating. So it does help to the business, but it does not help the child or family. So no, clearly no for AI, either in the diagnosis or management. There are areas for the diagnosis where there is lack of resources. There are areas in our countries where there are no experts available. So to help them, yes, it can identify the red flags. It can definitely diagnose the red flags and can say child is more chances or high risk, but needs proper evaluation. And that's the role it can be. People also think, oh, wow, we know this is not autism. It's a virtual autism. This is new autism. Is it so? Answer is no. Again, it's the same primary autism. We know children are now addicted or getting addicted to screen. So core features and therapies remains the same, but we know trigger is known, that's a screen, and we can remove or avoid that. And it's a good outcome if appropriate and timed interventions are done. But these children do continue to have some behavioral comorbidities, anger, opposition, violence. So they are still on the spectrum of autism, and it remains autism. We may relabel things, new label things, but primary autism remains there. Wow, I have heard specific exercise can help the child. Is it true? Is it so? Yes, autism should be assessed by specialists to look for the strength, weaknesses, and individualized tailored plan should be made, which should be reviewed regularly and updated frequently, and the new plan is to be given. So core principles of management and therapy are human interaction and social communication. And that includes play, sensory, behavior, life skills, social skills, all those things. And it's essential so that they can live self-sufficient, independent life to the full potential. And of course, relationship development intervention. And who are the best therapists? Who gives a good human interaction and social communication? It's a family, parents, extended family, and they should be core part of the therapy plan and the management plan. And they should do this lots of things. So which therapy should be done? The essential appropriate therapies as needed, according to strength and weaknesses and the related stage of the child, it with combination of different other OT, SI, speech, play, behavior, but it's to be tailored as per the child's need at that stage, not everything at a time, everything together, and it has to be modified. There can be so many other therapies they can add to, but it does not replace the main thing. They are not the mainstay, and people do lots of funny and new things and say this works, that works, but we have to be cautious on that. I would say yes for few therapies. It should be appropriate specialist who knows the autism, who have understanding and can do things. It should be individualized, tailored, regularly assessed, planned, and updated. It must include home-based plan, parents and family training, and home plan should continue and homework should continue. Without that, nothing is going to work. So family therapy is a must. And parents have to be waken up that don't be biased and reliant on other people. You learn the things. Small group activities, definitely yes. Life and social skills, definitely yes. And of course, school and education support. And big no and red flags. Yes, I am saying big no and red flags just for isolated speech and ABA. People say, oh, child is not speaking, let's start speech therapy. Answer is no. Don't automatically refer to speech therapies, child has speech delay. Try to get specialists involved, understand what are things, and then appropriate therapy as needed. Or just ABA, this is behavioral issue. बच्चा धमाल करता है, बैठता नहीं है, चिल्लाता है, start behavioral therapy. No, not straight away ABA. And we need to know what is ABA. ABA has two big principles. One is positive reinforcement and there is negative reinforcement. And most of the people doing ABA in India, yes, I'm saying very loudly and clearly, most of the people doing ABA in India are not properly trained or qualified. And they do negative behavioral assessment and support. And they shout, they scream, and they make parrots, they make robots. And even we know parrot can say Sitaram or what we say. So child starts speaking. What's your name? My name is Nitish. Anyone says, what's your name? My name is Nitish. That's not the communication. That's the आपने इसको तोता बना दिया. We don't want totas or robots. We need communication. We need to understand socialization. We need to have non-verbal communication. Those things should be planned. No for fancy therapies. No for gimmicks and frauds. ये कर देंगे, वो कर देंगे. We will do this much package. Money making business. इतना पैकेज दे दो, इतना लाख दे दो, मैं इसको ये कर दूंगा. No, these are all money making business. Stay away from that, parents. And even we as a specialist should avoid this happening. Online AI therapy centers packages. I'm yes for appropriate therapies and support where family is involved, family is trained, family is supported, and the family home plan is given and home plan is done. But not just 2 घंटे 3 घंटे 4 घंटे थेरेपी सेंटर में आओ, इसका 50,000, इसका 1 लाख, इसका 2 लाख. Those packages, answer is no, no, and no. These are all the business gimmicks. Okay, now last 5 minutes or so, some important things. Any specific diet for autism? And everyone says, oh yes, GFCS diet. Answer is no. We know extreme of nutrition is known for autism. You give appropriate supplements if child is deficient. Breastfeeding is helpful, vitamin supplements, all those things, yes. And avoid allergy causing food or specific triggers which causes or like e-substance, chemicals, menda, high sugar content, high chocolate content, avoid. But no for GFCS diet. It was a fashion, gluten-free, casein-free diet, milk nahi dena hai, milk products nahi dena hai, gehu nahi dena hai. No, that's all rubbish. People who have celiac disease, they require GFCS diet. And celiac disease, 50% say autism. So that's agreed. So celiac disease gives GFCS diet. But otherwise, routine, healthy, balanced diet. So only diet for the children with autism is healthy, balanced family diet. That should be given. Can specific medications or herbs can cure autism? Lots of things, Ayurvedic, homeopathic, but no proven data. It's just a placebo effect. Fashion comes and goes, and it's all gimmicks. And some of things can cause more harm than good. And now and then we always get, oh wow, doctor or the pharma or something. There's a miracle cure. This thing does work. We have now got new substance developed. This works, that works. These are all the placebos, and these are all the marketing gimmicks, because they need something new, fashionable in the market to work. I think I need to go to the myths. I'll say no for hyperbaric oxygen, no for TMS. Stem cell, again, answer is no. It's on the research only. Research, it is a huge business. People are getting trapped into that. But it's research only, which is approved by ICMR, and specific centers can do that. And it's not approved as a therapy, right? And if it's given as a research, it's a free. We think research, once we know what's actually caused autism and genes and things, stem cell can be the answer, but it's a real hope, real future, but not at the moment. So don't get into trap of the stem cells. It's a fraud. So last couple of minutes, sir. Our philosophy means when disease is poorly understood, or condition is not understood well, there is no cure, chronic condition, and frustrating situations, there people look for all possible resorts, which may or may not help, or even it may harm, because we think, let's try by chance if it works. There's always a hope. And as doctors and family, we always want to do something positively. Sometimes we feel pressurized, and emotions of the family and ours as well. But our role, first, no harm. Second, provide family with the current best evidence, what's right, what's wrong, as a professional guidance, and leave the family to make the decision. And we all should remain within our professional boundaries. Yes, we should keep hope alive and get in the right direction, get updated. As a family role, I think, please, family, parents, do not get stressed. There's plenty of help available. You should know red flags, early diagnosis, early interventions help. So make sure you don't delay the time. Get appropriate professional help who can understand the child and autism and can guide you in a proper way, not just a direct therapy centers, which is no. You need professionals who knows autism. Parents training, home plan, family therapy, that's must. That's must. Human interaction, social communication are the key. So even child doesn't have autism, do this. It's very much required. Stay away from traps, packages, and marketing gimmicks. And of course, no to screen, please. So my final slide. What is our obligation? To make an impact to achieve the best outcomes. Early recognition, early reference, and early intervention. Comprehensive diagnosis and assessment. Family counseling and support. We know it's a lifelong condition. There is no cure, but it can be managed. And only thing which works is appropriate specialists, experts, and therapy. And with appropriate therapy, timely management, and intervention communities, it helps a lot. With a healthy balanced diet, no to experiment therapies, and we aim to see the child live self-sufficient, independent life to his or her full potential. So thank you very much. And I stop my screen here.
Dr. Nitish,
Sir.
I'm really enlightened, and I hope that all the viewers of Adolescent India, 27,000 members, and the public itself will definitely appreciate. I could get 5 points out of your talk, not for doctors, but for the public.
Sir.
Minimum use of digitally, antenatal good care, right time marriages, less stressful life, and healthy diet, along with healthy positive communication. That is exactly required for all the girls, because the late marriages are all creating problem in so many fields, because people, children, girls, boys, both are after the jobs, career
Sir.
oriented. So when they are career oriented, definitely late marriages is occurring, particularly in now in villages even, not only in the major cities of our country and the world. So I think uh, it's very fruitful. Really, it was so enlightening talk that you have really cleared the views. Even my views are so much clear about it, and
Sir, humble, sir.
definitely the all the our colleagues will be benefited with this talk. Thank you so much for.
So to add two keywords,
Yeah.
human interaction and social communication, and that's what we all are lacking nowadays, and that's key.
Yes. Yes. facilities are available, but people are unable to talk to each other.
Sir,
Physically, they are talking only on digital mode. Thank you
sir.
so much.
Thank you very much, sir.
Thank
Thank
you.
you.
Bye.
Thank you, sir.